Good afternoon everyone, and a very warm welcome to all our viewers and listeners joining us today. You are tuned into the intellectual Fireside, igniting ideas, inspiring generations. I am Pratyush Raj, a volunteer at Amity University, Reiki Foundation Center for Science of Happiness, and it's an absolute pleasure to be your host in today's podcast. I would like to express my extreme gratitude towards our Honorable President Dr. Ashok K. Chauhan, our Chancellor Dr. Atul Chauhan, and our Vice Chancellor Dr. Barvinder Shukla ma'am for their extreme support and constant encouragement. With their constant encouragement and vision, and under the leadership of Dr. Nitin Arora from Amity University Reiki Foundation Center for Science of Happiness, in collaboration with Amity Radio, this podcast series has been made possible. We are also delighted to share that this recording will be available for our listeners on 107.8 FM. Now it's time to introduce our distinguished guest for today. We are honored to have with us Dr. Gautam Unny, a highly respected veterinary professional with more than 30 years of experience in animal care, compassion and clinical excellence. He is also the author of the deeply moving book, Tales of Wagging Tails, a collection of real-life stories that beautifully capture the emotional bond between humans and their animal companions, while also offering profound insights into responsibility, empathy, and ethical decision-making. Sir, it is truly a privilege to have you with us today.
Thank you so much, Pratyush, and that you've called me for the very first episode of your new series. It really makes me feel very, very good, and it's very kind of you and all the people at Amity here.
Thank you, sir. So, sir, to start with, I would like to take you back to where it all started. Sir, what initially sparked your love for animal?
You know, when I look back, I think it's all karmic and destiny, that you're born with certain vasanas and that we have it within us to be something. And maybe from the very beginning, I was destined to be a doctor, a veterinary doctor, because on the age of 4, I used to visit the stud farms of the RVC. RVC is the Remount Veterinary Corps, the horse-ridden veterinary wing of the Indian Army. You know, the Indian Army requires horses, mules, sniffer dogs to look after the army and the heights as well as everywhere else. And obviously, they have an entire corps, corps for this. And the Remote Veterinary Corps, my uncle used to be working there. And I was, I think, 3 or 4 when it's there on my Facebook posts. I was 3 or 4 when I first sat on a horse, and you know, I was surrounded by military dogs, and those memories used to fascinate me a lot. I used to tell my parents, you know, I'll become a veterinary doctor one day. And you know, just like we all as kids used to say, मैं पुलिस वाला बनूंगा बड़ा होके, या मैं firefighter बनूंगा बड़ा होके, so they probably thought it's just a passing thought, and you know, he's infatuated by this. But each subsequent year, when I kept visiting these stud farms and spending more time with army officers, it kind of came into me that I really want to be a veterinary doctor. And as fate would have it, I ended up in one of India's best veterinary colleges in Madras, which is known as the Madras Veterinary College. I passed out way back in 1997, and the last 30 years, close to 30 years, have been a blur, and they've passed so fast. I've learned so much, and I'm so thankful to God that I am able to pursue a profession I truly love. Even 30 years later, when I get up in the morning,
Yes, sir.
I still want to go to the clinic. I don't know how many professionals will be there in the world who can say the same, that they want to go to office.
Very true, sir. Very true.
So I'm blessed.
Very true, sir. Since you talked about, sir, army, my father is also in the army.
Lovely.
So from my childhood, I have been seeing officers with their dogs playing in the parks. And from there I was like, I also used to go to the parks and play with them, and that gave a different sense of happiness altogether. So from there I was motivated. I have always wanted, I've always told my parents also that I want a dog, and from there itself, finally 4 years back, a purest soul in my life till now came into my life, and from then the happiness perspective, the happiness quotient, whatever you call it in the scientific way, has gone up to the optimum level of, or beyond the
I'll
optimum
interrupt
level.
you here,
Yes.
Pratyush, because you use the correct word, the purest soul.
Yes, sir.
After being 30 years with dogs, you know, dogs are very pure in the sense, if they are nasty, they're nasty on your face.
Very
Right?
true, sir.
If
Very
they are
true.
going to bite, they'll bite you straight. If
True,
they are
sir.
loving, they are loving.
Yes, sir.
There's nothing that they are nasty behind your back.
Right, sir.
I don't think I can say the same about humanity.
True, sir.
I
Very
might
true.
be sitting in front of you and praising you, but behind my back there'll be jealousy,
Yeah.
hatred,
Very
and
true.
so many other emotions, something which I have never seen in 30 years in dogs.
Very true, sir.
My favorite dialogue in the clinic is that you kick your dog in the morning, okay, in a fit of anger, but the first person to receive you when you come back from home, when you come home and you open that door, will be your dog.
Very true,
He'll be there jumping. He has no burden, he is not carrying any emotional load which says that guy was mean to me, therefore I shall also be mean to him. Can we say the same about our own families or our family members? No, we cannot. I have always said we have a lot to learn to be, how to be from dogs.
Very true, sir. And I heard somewhere, or I read somewhere, that people often ask that why do dogs have such short lives? So the very beautiful answer I came across till now.
They have nothing to learn.
Yes, sir. They have
nothing to learn. It's us who require 100 years to learn, and
Humans-
we'll still never learn it.
Very true, sir.
And I think the same story we both read, they have absolutely nothing to learn.
Yes.
They are here to teach us.
Yes, sir. Absolutely. Very true, sir. So, sir, once you entered into this profession,
Yeah.
and once you become a veterinary doctor, so what was your first feeling like when you interacted with your first patient?
My first patient was a mixed dog which looked like a corgi,
Okay.
and her name was Choti. You cannot forget your first love and your first patient,
True, sir.
okay, or your first dog. She was a corgi mix, and her name was Choti, and a very sweet little dog. She was adopted by somebody,
Yes, sir.
and in 1998 the industry was nascent. There was no veterinary industry. There were maybe about 50 veterinarians all across Delhi NCR, and today there are 500 to 800 private clinics in Delhi NCR, whereas at that time there were not more than 50. So to enter an industry where there is absolutely no work is not easy.
True, sir.
Okay,
True, sir.
it used to be weeks before we used to see our first patient, and luckily for me my clinic was in my residence, so there was no rent to factor in, and I'm very proud to say that everything from cleaning the tables to mopping the floor I used to do myself because I couldn't afford an assistant. I'm proud of, because even today if my clinic is dirty and my cleaners are busy, I have no hesitation picking up a cloth and cleaning the table. Nothing is big or small.
True, sir.
It's the respect you give to the profession. So from those humble beginnings, when we used to sit without work, and I drove my parents mad because they bore the brunt of my emotional outbursts of being without work. From that time to a time today when it's diametrical opposite, when I have no time to sit, and now we are crying why is there so much work. It's been such a long journey full of sacrifices. The word is sacrifices, because doctors as a profession, we give happiness to everybody except ourselves. Our families are upset because we don't have time for them.
Yes, sir. It's very demanding.
And it is a profession where you cannot keep your phone silent. You'll have come back from work, when you're having dinner and your wife or son will be talking to you, or your daughter will be talking to you, and then suddenly you have to pick up the phone, and they get angry because after all they have been there without you the whole day, but you would have just operated upon a patient who is critical.
True.
And it is your duty to pick up the phone. Now if you don't pick up the phone, it's a moral dilemma, and when you pick up the phone, it becomes an emotional dilemma. So it is a line which demands a lot out of a person, but I think what keeps us going is the fact that we are providing care to a being who cannot speak.
Very true, sir.
Right? They cannot speak. They only have us and the pet parents for who will give support, and therefore I think it is a calling for a very select few are selected to be veterinary doctors, and those who do it well, I think we shall get good rewards in our whatever way, because we are doing God's work.
Very true, sir. Sir, you said the very right thing, that veterinary doctors deserves a lot more respect. I mean, if you talk about human doctors, the normal doctors, they have the patient who can speak.
Yes.
Who patient can communicate what the problem is, what he or she is going through. Otherwise, I mean, with a dog or with a cat who cannot speak,
yes,
I mean, it's very difficult to actually.
Two lines, Pratyush.
Yes.
One is the pediatrician.
Yes, sir.
And the second is the veterinarian.
Yes, sir.
We both deal with patients. It's our instinct, it's our experience to see symptoms, and that's how we are able to diagnose. But you must remember, human doctors have the added facility of referring. They have specialized cardiologists, neurologists, and they can go for an MRI, a PET scan. Because of many factors, including costs and the fact that insurance has not fully entered the industry, these things are going to take a little time, but makes our line more difficult to manage. But still we are doing a good job.
Very true, sir. I mean, that's not something that I can disagree on. I have personally seen.
How many human doctors are bitten by their patients? We are.
Thankfully, my dog doesn't bite he's very friendly to all the doctors. I mean, he's over friendly.
Yeah.
Anyone comes to my home, he's just with a wagging tail, with the helicopter speed, he goes and greets. That's very happy to see, sir. So I just want to know, sir, what was your inspiration? Like, who inspired you, or is there anything which inspired you to be?
My uncle is there in the book. My uncle, Lieutenant Colonel Babu, he was the person who inspired me to become a veterinarian, and maybe it was the crisp uniform, the haircuts, the sharp haircuts, and all the emblems on your chest. It somehow gives you a sense of pride. It's sad I didn't become a veterinary officer, because by that time my calling was more into private practice. But whatever you say, my stint at the RBC in all the stud farms in and around Delhi, that was my inspiration.
Very true, sir. You talked about smart and with handsome boys and handsome gentlemen with crisp short haircut in those smart black uniform.
Yes.
That have always fascinated me. I mean, even I want to join the army. I have given 2 of the SSBs also.
Lovely.
Initially, I could make it through the final phase, but in the final phase, I was not selected. So I have still many chances to opt for the Indian Army, which I definitely will. So, sir, I have read in your book that you started with a 1-room clinic. So what were those basic initial days like? Like, what were the challenges?
Terrible, horrible, because you have no patience, so there's no money coming in, and whether you have money coming in or the outgo is always the same, right? And as I told you, since I couldn't afford anybody to clean or do anything, I used to do all that work myself. Even for a very simple task, like for example, what we take for granted, the newer generation vets take for granted, taking an X-ray. In the 90s, we would have to go to human labs and talk to them and request them, beg them to take X-rays in the non-clinical hours. Okay, forget about facilities like the MRI or CT scan, which has now come up. Something as simple as a blood test used to be so difficult in the 90s. So it was a very challenging period. But I'll tell you, Pratyush, what is very good about that phase. It made us better clinicians, because the younger veterinarians, they rely more on labs and clinical tests as human doctors do, and they base their findings on these tests, whereas we have got more observational skills. When a patient walks in, we are able to tell a great deal of information just by the way they are walking, by the way they look, by their eyes, because we are so trained, because we did not have these facilities, yet we used to treat these patients. So I think our generation is best suited today, because we have the experience of a time when there were no diagnostics, but now we have all the diagnostics. So we are very, very well placed. And through your podcast, I'd like to tell my younger veterinarians to of course go for diagnosis, clinical tests are required, but also to use common sense and go for physical examinations, look for signs which are taught in signs and symptoms in your book, look for that also.
Very true, sir. I mean, this is a very beautiful reminder of how challenges make you tough.
Yes.
So, sir, in those challenging times, when did you feel that yes, this will succeed?
Maybe about the 8th year of my practice, when for the first time I had to hire more than 2 people to look after patients in my clinic. Then I realized, yes, now the train is on its tracks. That is when I felt, yes, I will be able to succeed. The industry had opened up, dog food companies had come in, they had started advertising a lot, and what I curse today for the bane of the pugs, the pugs, those cute little dogs, in 2001 or 2, Vodafone had come out with an ad. Had come out with an ad that this network follows you everywhere, and they put a pug into it. So what happened was, it caused an indiscriminate breeding of that breed, and that the breed today is in a very poor state of health. However, it opened up the industry because people started thinking about dogs. There was a very emotional connect. Maybe it's one of the best ads for the dog industry, but it didn't do very well for the breed, but the industry opened up.
Yes, sir. That's true, sir. I have watched that ad and I have seen that. So, sir, in those challenging times, in those early days, you said there were not enough resources or the resources which were required at that time.
Yes.
So, how did those cases, how did that shape your confidence over time?
I just told you, we became just better vets because we were able to put 2 and 2 together. For example, if I give you a disease called pyometra or pus in the uterus, today all I have to do is, I see the patient, I put my ultrasound on the stomach, and I can see an enlarged uterus full of pus. But at that time, I would have to look at the blood values, I would see an elevated blood count, I would see the symptoms, she is drinking too much water, she is having a lot of urination, or then I would rule out diabetes, and then we will see that her stomach is shaped like a pear, and her heat cycle was 2 months ago. So we began to put things in a very systematic manner. So that helped us become better physicians, better clinicians. Same way, even if we had a problem of arthritis, we used to palpate each and every joint, from the toes, we used to go right up to the hip, from the hip we used to go to the spine, we used to localize the pain, which is now done by a single X-ray.
Yes, sir.
But because of that, we were able to become better doctors, and this skill set has to be taught to the younger vets.
True, sir. That has definitely shaped and enhanced your observation skill very much, sir. I mean, what nowadays can be seen through the machines, back then you guys were not having those machines.
No.
That was definitely a very difficult phase for you all. So I would like to now shift the focus towards your wonderful, deeply moving book, Tales of Wagging Tails. I've personally read this, and the way you have articulated your 30 years of experience, and the way you have penned those experiences is just commendable, sir.
Thank you.
I'm a fan of this book now.
Thank you.
And being a pet parent or a pet brother, I would say myself, I could relate myself so much to it that I was just, after each and every chapter or each and every relatable line, I was like to stop the book and go to my parents and tell that story, see how we can relate to the story. So sir, what inspired you to write this book?
See, COVID came at a time when the world suddenly stopped, and I mean, for a person who is used to working 12 hours a day, to be sitting doing nothing and working maximum going to the clinic for 2 hours a day, and we had a void about 14 hours to fill, and we didn't know what to do. So many of us veterinarians, we did online courses, including me. We studied different courses, we studied more, but still there was time on my hands, and that is when I decided that I'm going to write something which is my basic core philosophy. Every doctor has a core philosophy through which he lives his life, and I wanted to pen those down, and I wanted to thank so many people. We are doctors today, successful people, only because people have put their trust in us.
True, sir.
I have always tell my younger generation that no pet can walk into your clinic. You have to be first in a position to convince the pet parent or the pet brother like Pratyush that this guy is good enough, to trust.
True.
And there are so many people and so many incidences that I wanted to thank them, to say that okay, you have put your faith in me, and I want to say thank you through this book. And even there are many people in this book who have been with me for 30 years. First dog, second dog, third dog. They have been with me for 30 years. They are more than a family. They are children. I have mentioned it here, who were born, who were young, who used to come with puppies. They are married today and they have their own kids. I mean, I have seen so much. And if I don't say thank you to the world who has been so kind to me and to the Almighty, then I am not doing justice. That's why this book was written.
Very true, sir. I mean, being grateful to whatever you have in this world is very much important in today's life, and always. So, sir, I would like to know your personal favorite chapter from this book.
My emotional turmoil through the clinic is a very important topic, because if life is very simple to you, then you will never be grateful to God. You remember God, or you remember you bring your inner faith out only when the times are tough and you face your worst fears. So that chapter where I have said there's so many difficult opportunities which I have faced, that chapter is probably very close to my heart, because even in the darkest moments there was somebody always there to help me. Somebody always there to help me, and he used to come like without being called. They would just walk into the clinic, and so that chapter is very close to me.
I must say, sir, and to all my viewers and listeners also, that in that chapter, the way sir came out of that darkest phase, I must say, is just commendable. I mean, I won't give the spoiler that what was that dark phase. You must go and read that book. It's really interesting. So, sir, in this book, which was the most difficult chapter you found to write?
The deaths I faced. The different deaths which you face. You see, when a patient dies, no doctor wants that to happen. It's not only bad for his image, but people don't understand that even we have a very strong emotional connect with our patients. And at that point of time, when not all, but a few people come and say, "Tumne paisa le liya," or "You did it for money and you killed," it hurts a lot. Whereas just before this podcast, you heard people saying that I take up challenging cases. I take up challenging cases which no other doctor takes, because I am not afraid of consequences. If I have a skill set and I don't use it, fearing that my name will get tarnished, God is not going to be very happy with me. So I take up the toughest cases. And when you take toughest cases, you're going to lose some. But when that happens and you're blamed for it, it hurts a lot. At the same time, we know that there is always a phase of denial, there is a phase of acceptance, there is a phase of rebellion when a death happens. It's just a phase. Some people come out in 30 seconds, some people take 2 years. Okay, it's not only me, it's in every profession that you're going to face it. So we just have to accept it and move on. And the best part is, like I have said, we have to smile and go on to the next patient. We don't have time to grieve. Our own sorrows have less precedence because I have more lives to save or try to save.
Yes, sir, indeed. I mean, death is the ultimate reality we all have to face at one sometime. You also mentioned that how once you lose a pet, and then how you come out of it.
Yes.
And it's really sad, but we have to, So, sir, I would like to ask that after each death you faced, after you have seen losses of pets in your life, so how do you come out of it?
How do we come out of it? It gets, if you say it gets easier over the years, it does not. It does not, because even a pet dies, even if it's not guilt, there's still something, where we call our solar plexus in this area. You will feel a deep pain, and it takes days for that pain to go, because when you see the grieving parent, pet parent, you always put yourself in that position. I have been a doctor, I have been a pet parent, I have seen death of my own pets, so I relate to both sides, and I know it's not going to be an easy thing. So it takes time, but we console ourselves that I staunchly believe in the Bhagavad Gita, and I understand the fact that I cannot do anything without God's will. If I am healing people, I do not take the credit for healing people. If I am giving that credit to God, then if I lose a patient on the table, that also should be God's will. That is how I keep myself calm, because if I don't stay calm, my team under me is not going to stay calm.
Yes.
And then I will spoil the lives of not only those people working with me, but all the other patients who have come on that day.
Very true, sir.
So as a team leader, the strength to stay calm is very important, and I take it from this very basic fact that, like we say कि भगवान के इच्छा के बिना एक पत्ता भी नहीं हिल सकता. I staunchly believe in it. That is my core philosophy, and that is what I live with.
True, sir. I mean, that's a great way to keep calm, because a leader has to remain calm at all times. So, sir, in your book, Barfi's demise is, penned down very emotionally.
Yes.
Sir, what was that feeling what was the feeling that got struck during that time?
Terrible, because Barfi belonged to the lawyer who fought my case free of cost for 12 long years in the lower court and high court, and his name is Advocate Sai Krishnan and Advocate Bharat Kumar. They have been such kind souls that in my darkest hours they told me, as long as we are there, you are not going to worry, we will fight it out at every single level possible. And as professionals, they were well justified to take whatever money they wanted from me, but being pet lovers, they never took anything from me. And when I got a chance to pay back, to try and save Barfi, their Saint Bernard, we were doing the surgery, and suddenly Barfi passed away. And then, the first thought was, I couldn't even do this much for Barfi and his pet parents. And then you have those thoughts of grief, of sadness. But when I came out, instead of me consoling them, they were consoling me. They were saying, so what, doc? If that child was supposed to go at that particular hour, nobody could have stopped him. That graciousness and that love which such pet parents shower on me is probably one reason why I am still sane today.
True, sir. Then, sir, coming to Shaggy, sir, you mentioned that how he was like a brother to you in your teenage years.
More than a brother.
More than a brother, surely, sir. So, what did that brother taught you, sir?
Let me tell you, I had a bit of ADHD, attention deficit hyperactivity disorder, and I used to be a very fidgety kid, and always doing something mischievous, and I always wanted a dog. And one day this brown little dog walks into our house, and my dad, fortunately or unfortunately, gave him a little milk and bread, thinking that he is looking tired. He didn't go day 1, he didn't go day 2. Third day I said, let me keep him. And my mother said, no way, you're not keeping this dog, because who's going to look after him? But he never left us. We took him to the Rashtrapati Bhavan dog clinic, and we got him vaccinated, and he stayed with me. He taught me patience. I used to hug him, I used to wrestle with him, I used to pull his ears, I used to pull his legs, and all I would get in return were lots of licks. And somehow that maybe he was an emotional sponge for me. Maybe I was searching for something, we are all searching. We're searching for unconditional love, and maybe Shaggy gave me that, and he brought me out of a very difficult phase where I was always looking out for trouble, and not trouble, but I was always doing something naughty, and I put my energy into him into combing him, into walking him, into giving him a bath, you know. So that my extra energy went into looking after my little brother, and that way he, and I always think we adopted him, but I think he adopted us. He walked into our house, he adopted us, he wanted to share his good karma with us or something of that sort.
So sir, looking back during those times, do you ever feel that okay, Shaggy did became your one of the sources to become a veterinarian?
Of course, of course. Where do I go again? Where does God take me? I used to live in Moti Bagh, and right next to me was the Moti Bagh Veterinary Hospital. But no, my dad would take me to the renowned veterinary corps hospital in Rashtrapati Bhavan. And where, what do I see? Again, smart young men in army uniforms wearing those smart buckles and you know those smart haircuts which I loved so much, and they were veterinarians. Yes, destiny has its ways, and you know it pushes you towards that certain goal. Maybe if I was tending to forget that I wanted to become a vet, those 8 to 10 years I had with Shaggy, every year going to a army vet, talking to them, being with them, and it used to rekindle that desire. Yes.
So sir, you talked about how pets love unconditionally, and while it is not the same with humans. So my question is, why do pets love us unconditionally?
Why do? Because God had to give us an example of what we should be. You know, the best way to be a mentor or a leader is to lead by example, and dogs do that. They tell us how to live without excess greed. You know, a lot of times what happens is these dogs come into our clinic and they'll be wearing these artificial gold chains on their neck, you know, and I playfully remove it from their neck. Not bothered. Try doing that from a human being. It's our sense of materialism which has spoiled our emotional connect, whereas dogs just don't have that. They only want, what does a dog want? A little food, exercise, and lots of time with their non-furry family. That's all that a dog wants. They don't want really anything else. A cheap coat, a fancy coat, a waterproof coat, a big bed, a small bed makes no difference. If you are there with that dog, that's all that it requires. Can we say the same about ourselves? For example, my guru always says whether you wear a Rolex or you wear a HMT, the time is going to remain the same.
True, sir.
But we are running behind the Rolex. Okay, true. Coming here to Amity, I could have come in a Mercedes or I could have come in a Maruti. But given a choice, I would still probably say I would prefer to come in a Mercedes. But why? A dog would be happy in both. He'd be looking out of the window, panting and looking at the different schemes of thing and being happy. Why don't we learn something positive from there? This is something I always speak about. The younger generation too must learn this basic concept of minimalism. We don't require too much to be happy. Happiness is not coming from anywhere. Happiness is here between your ears. That is something we have to understand.
Very true, sir. You have very beautifully conveyed your feeling. So sir, that brings us to the next topic, which is often quite controversy these days. Should you become a pet parent or a pet owner? Because I have seen the way they both behave. I have seen in maximum of the cases that a pet parent will actually behave like a parent. Like if you have your son, your daughter, you would treat them the same day as your dog. But whereas a owner, I would say they are just looking after
that's property then.
Yes sir, that's their property. That okay, isko walk kara do, like go feed him at correct time, or just takes care of the basic facilities and doesn't spend much time with them.
Okay, so let me quote the Bhagavad Gita again. Okay, the Bhagavad Gita says that each and every Atma, whether it's a dog or a human being, is the same. And I believe in it. When I see a dog, I do not see it as a dog or a cat. I see it as an extension of myself. Okay. So why would I then not want them to be a family member? Why would I want to own it? Second, one of my favorite dialogues, it's mentioned in the book again, this carpet and kutta concept, you would have read about it, okay, that once you have reached a certain level in society, aapko ek car chahiye, kutta chahiye, carpet chahiye. That's the materialistic viewpoint, but that's not the way. That dog also has a set of karmas to play out, and that's why he has come into the family. Dog, cat, animal, whatever, okay, they have a certain set of karmas to play out, and you have a certain set of karmas to look after them. So if you are an owner, I don't think you are doing full justice to that job. That dog or cat never said, take me into your house. You went out and bought a patient into your house, then it's your duty to look after it. Now, if you read my books, I have always said, it is not a toy. Okay, Papa, it's my birthday, I want a turtle. Fair enough, here, this is your turtle. Have you thought about the fact that the turtle is going to live for 60 years? Your son might be 10 years old. That turtle is going to live for 60 years, 70 years. Your son will be 80 years old when the turtle will still be alive. Will he be in a position to look after that turtle? Do you require a turtle requires so much care, washing off the glass cabinets every week? Do you think you can do it? If you cannot do it, who gave you the right to bring that life into the world? If you don't have a demand, there will be no supply, and the turtle will continue to live in the natural habitats. That is my philosophy.
Very true, sir. So now we have two guests who will ask questions to you, Dr. Unny.
Sure.
First is Dr. Daulat, who is the Director of Library Service here in Amity University, Noida. And then later on a student will ask a question. So I would now request the two of the guests to come and ask.
Okay. So nice talking to you, sir, on your books, and also congratulations.
Thank you, sir.
These two books, I'm sure this will be valuable source of information for all the pet lovers. So since it's about pets, I'll start two questions regarding pets only. My son has got two he cats.
Okay.
They are Indian species, but they are in Hyderabad. So just when I was coming for the interview, just reminded me to ask him. So he said that one problem just now started is that in case of one cat, the hair fall has started.
Yeah.
And in case of second cat, the guy has lost interest in taking food properly.
Yeah.
Earlier he was feeding them, half of the 50% of the food from market and 50% the cooked food, and he was enjoying taking all. But last few days he's not taking the food properly, and also is losing weight or something, getting weaker and all. So these are two questions on the pets. If you reply, then I go ahead for something else.
Yeah. So the first thing is, sir, for the child who is not eating, pet who is not eating, we always say that cats get bored very easily. So in cats, you should keep on changing the diet. And sometimes when you have the same brand or same food continuing for a long time, then they stop eating.
Okay.
Second, cats as a nature, they like to eat very early in the morning at 6 p.m. in the evening, dawn and dusk, because that is the hunting time. Try to stick to these particular times when you are feeding cats.
Okay.
And still if they are not eating, you must go for a blood test. And one reason why I am asking you for a blood test is that you are saying the cat is losing weight.
Yeah, so, it's got weaker. Yeah.
Yes, so when a cat is losing weight, cats as a breed, as a species, tend to have a little bit of kidney disease.
Okay.
Yeah, especially the male cats.
Okay.
So because they get blocked very easily. So one reason is to get a blood test.
Okay.
As far as hair loss is concerned, if the hair loss is all over the body, equally distributed all over the body, we are not bothered, because that is a sign that the weather is changing and a change of coat is occurring. But if it is from a particular area, either only from the ears or only one part of the body, then a veterinary visit is called for.
Okay. Good, thank you. Very useful information. No, I just come to the general questions on pets. We are having this discussion when Supreme Court is busy with that,
yes,
about stray animals. So what is your opinion about
Sir,
stray animals and stray dogs?
I saw, when I came into Amity, I saw a few dogs on the campus, and I was very happy. I was very happy that the dogs are still there, and they were happily lying down in the sun, and they were not troubling anybody. So my first concept is that if you properly feed the dogs, they will not be a menace to society. Only when you are hungry will you create trouble and run behind people. So try and feed the dogs. As far as my take on the Supreme Court, I have a very clear thought that you should not punish dogs for the lack of application of mind and money by the municipalities. It is not their fault that the number of dogs that there on the street today has multiplied. People did not do the ABC program properly. Money was, whatever happened, it was not done properly. So why are you punishing the dogs for it? You should instead, amount of money you are putting in to create artificial structures to keep dogs, why don't you increase the workforce, increase the number of veterinarians and do an ABC program on a large scale? If you do a ABC program properly, this problem will come to an end. The second thing, through your podcast and every podcast I say, people are talking about dogs, but people do not know that the cat population in India has risen by 70% in the last 5 years. Okay, so unless you take war footing on cats now, by 2035 you will have the same problem with cats.
Yes.
So then you will stay billi ko bhi hatao. So it is not a problem, it is a solution. Either you had a blanket ban from the beginning, which you did not, and there is a national wide law which says that you cannot remove a dog from its premises and they should stay in the premises and they should be neutered and put back. So if there is a law in place, I am personally against the fact that you suddenly arbitrarily remove them against a national law.
Again, it would not have been an issue at all had some unnecessary, unfortunate incident not happened because dog bites and then there were.
Sir, why are we talking only about dog bites? Even today I was reading about a SUV coming and killing a boy. Why are we not talking about those incidents? Why are we not talking about the fact that people are driving on the wrong side of the street and killing people? So we should not blame just because an SUV comes and hits a boy, but we will not stop selling SUVs or stop underage people from driving. We have drawbacks in the society, we have to work around it, but we cannot find fault on a being which cannot even talk and protect itself.
Since you talked about society, why Indian society, we are less pet friendly than many other societies in the West, for example.
Sir, but I don't think we are less pet
Because
friendly.
in US or UK or in those West European countries, whenever we go, we find almost everybody has got the pet with them. Here even if we are in a gated society, we find hardly out of maybe 50 or 100 families, only 5 or 10 will be having their pets. Otherwise, hardly anybody has got the pet.
Sir, the number has increased in the last 10 years. Decade, India has the largest pet industry in the world today. We are growing at the fastest rate. Please wait for another 10 years and see where we will be. Half the houses will be having dogs. But now the concept of keeping dogs has gone. Why? Because you have to walk the dogs, you have to feed the dogs. People are keeping cats. Cats are happy in the house. They don't need a walk. They don't need to be given separate food. Just you keep the food, you keep the toilet tray and you clean the tray. So because the headaches are less, the cat population is slowly increased. There is a very strong culture for keeping pets, and हमारे इतिहास में हमेशा dogs and cats रहे हैं, ठीक है? And all these dogs who are living on the street, somebody is looking after them, somebody is feeding them, they are getting injured, somebody is bringing them to our clinics for treatment. अच्छे लोगों की कोई कमी नहीं हमारे देश में,
अच्छे लोगों की कमी नहीं है,
कोई कमी नहीं हमारे देश में. इस यूनिवर्सिटी में मैंने देखा इतने खुशी से वह धूप में लेटे हुए थे. आई वाज सो हैप्पी सर.
Yeah, but university has taken a lot of steps because they are all sterilized and things.
That's
like
all. Do your job well and you will have less complaints.
Yeah, I think you are right. You have the point. Thank you very much, sir.
Thank you, sir.
Nice talking to you. Thank you.
Good afternoon, sir.
Good
I'm
afternoon.
Palak Chaudhary and I'm currently pursuing public administration in Amity. Sir, I heard your podcast and I feel you're the right person to ask me for me to ask this question to you. I have this fear of animals, but I also like them because I find them really cute and I find them very loving. So, but specifically dogs, and I want to adopt them one day, but because I have this fear, what should I do so that I can overcome this fear?
Okay. First thing is, Palak, you really don't have to be scared of dogs. And one thing I'd like to tell everybody, when you approach a dog, we always timidly approach the dog and we keep our hand on top of the head of the dog. Okay, that's a sign of dominance. So when you approach any dog, small, big, large, white, brown, green, whatever, approach from below the head. Let the dog smell you. That's a sign of submission. So dog rarely will attack you thereafter. But as far as your particular fear is concerned, don't go for a dog which is very aggressive. Okay, keep a family dog, maybe a Labrador or a Retriever or a smaller dog, and adopt them from the puppyhood. When you keep them from puppyhood, he grows with you. He becomes your family, and once he's your family, he's never going to do anything to you. you don't hurt the people you love. Okay, but since you're a first time owner, it's there in my book, don't keep a large breed like a Doberman or a Rottweiler, because they have alpha male traits. They like to dominate. They may be good for a person like me who has experience handling them. For you, go for a slightly calmer dog from a very young age, puppyhood, 6 weeks, and you'll have absolutely no problem.
Okay, sir.
Right?
Thank you, sir.
Thank you.
The questions asked by the guest were truly fantastic, sir. I mean,
Yeah, definitely.
Yes, sir.
Provoking, thought provoking.
Very, sir. So now one last question, and then
Sure.
we'll end this today's podcast. So, sir, I have often heard that when a pet comes to your life, a human being becomes more responsible. So, how would you comment on that, sir?
It's absolutely true, because if you do your job well and if you justify the role of a caregiver, you have to look after the grooming, you have to look after the feeding, you have to look after the exercise, the housing, and all the other things. Second, I have a line in this book which says, say good morning and good night to your pet every day, which basically means spend 5 minutes every morning and 5 minutes every night and look after your pet. Run your hands through the coat, look into the ears, look at the feet, look at the tongue. You will see small things which are changing, and if you have just seen your dog after say 1 month, you may not be able to see a visible difference. So bringing a pet means a responsibility for dog and cat for at least 15 years. So if you are willing to take up that responsibility, go ahead and keep a pet. Otherwise, please don't.
True, sir. I also would like to agree with that, sir. So as we come towards the end of this deeply enriching conversation, I would like to extend my heartfelt gratitude to Dr. Gautam Unny.
Thank you.
For sharing not just his experiences, but also his wisdom, compassion, and his life lessons drawn from decades for caring for animals and understanding the profound bond between humans and their companions.
Pratyush, I'd like to just add one thing, that if you have never tasted sugar and I say ki sugar meetha hai, you're not going to understand it.
True.
So through your podcast, this is talking about happiness, I'd like to say, keep a pet if you really want to experience what genuine bliss of happiness is, where you do not think about being betrayed, where there is no jealousy and only true happiness.
Very true, sir. I mean, I have personally seen that experience where how our life was before a pet, the purest soul, came into my life, and now it is. I mean, the moment you enter into the house, the atmosphere is completely different.
Yes.
I mean, it's just joyful all the time. So his book, Tales of Wagging Tails, beautifully reminds us that sometimes the greatest teachers in our life come with a wagging tail. Thank you, sir, for being with us today and
My
sharing
pleasure.
your profound insights for this conversation and more compassionate lens. It has truly been an honor, sir.
Thank you. Thank you, Pratyush.
And to our listeners and viewers, thank you for joining us on the Intellectual Fireside, igniting ideas, inspiring generations. Stay tuned for our next podcast, where we bring you yet another inspiring voice and another journey worth listening to. Till then, stay curious and keep the fire of igniting ideas alive. Thank you.